Hey guys, I'm going to share some information about tendon pain. Any kind of tendonitis, which we now know is not called tendonitis, we call it tendinosis or tendinopathy. It's just a little bit more clear and specific diagnosis for any kind of tendon pain. I'm going to give you the general formula that we use for fixing painful injured tendons. Things have changed over the last several years. First of all, the name change, like I said, moving from tendonitis, which means inflammation, to tendinopathy. We know it's not an inflammatory condition, so doing things like resting, icing, compressing, and elevating, like the old school Rice protocol for injuries, does not work. The most important thing to do for tendon pain is to load the tendon. That means strengthen the tendon that's actually injured, and we like to do this in a specific manner. So this protocol, this loading protocol, can be utilized for any tendon pain or any tendonitis or tendinopathy that you have or that your friends have. So if you have any friends with any kind of tendinopathies, share this video with them. Here's the formula. You load this specific tendon 3 to 5 repetitions, 3 to 5 times a day. A little bit of pain is okay. And you do that, and we start with 2 weeks. So a 2-week loading protocol, and then we switch the exercise. So since this can be applied to any tendon in the body that's painful, from the Achilles tendon to the posterior tibialis tendon, the peroneal tendon, the patellar tendon, hip flexor, adductor, gluteal tendons, tendonitis of the elbow, both the outside, which is tennis elbow, and the inside, it can really be applied to any tendon disorder. Just write in the comments what you have or what your friends might have, and I'll do another video especially showing that specific exercise for that tendon problem. A couple of little things here. We now know that if you're stretching a painful injured tendon on the attachment point, it's not good. So if you're doing a lot of stretching, let's say you have an Achilles tendon problem or a high hamstring problem and you're doing a lot of stretching, stop with that. Stop with that and start loading it instead. The other important thing to know is tendons take a long time to heal, to fix. A traditional protocol takes 12 weeks of appropriate rehab, appropriate loading. Now here, we don't treat people for 12 weeks usually. We throw what I've coined the AT methodology, which is a couple different kinds of soft tissue mobilization techniques, laser therapy. We look up and down the chain to see, if there's intrinsic impairments and some of the other extrinsic things, like what are you doing that might have caused this in the first place. So we look into some of that stuff, but the meat and potatoes is the loading. So like I said, mention in the comments what kind of tendon problem you're having, and I'll do a special video just for you. Thanks for watching.